Community and Public Health Committee for Tuesday, November 19th.
And I will call the roll. I'll start with you, Commissioner Gerardo.
Here.
And Commissioner Salgado.
Here.
I will read the land acknowledgement. Thanks. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. Commissioner Gerardo has asked that we move public comment up after the approval of the minutes, so just a heads up to everybody on that today. The item 2 is the approval of the October 15, 2024 committee minutes.
I so move to accept the minutes of the October 15th meeting. A second.
Is there any public comment on this item in the room? All right, there's no one has received permission to make public comment remotely, so all those in favor?
Aye.
Aye.
Okay, the minutes are approved. We can move on to general public comment. This is a time when folks can make comment about items or topics that are not on the agenda. Is there any public comment today? Sure. Come on up. Everyone has 3 minutes, and when the timer goes off, please know your time is up.
My name is Ariane Harrison. I'm the Executive Director of Marie Harrison Community Foundation for Social and Environmental Justice. We're located in the Bayview District. I would like to acknowledge that there has been an immense amount of exposure to toxins in our community, as well as poor air quality. What I'm proposing is for our clinical professionals and some of our institutions that are existing in the community and outside of the community. I'm putting out a call for those that have backgrounds in the sciences and medical field to actually come to the community and support us in Dr. Hinsman Sunshine Porter with what she's already doing to find funding to do specialized health care treatment for District 10 residents. I am a person that has been toxically and chemically exposed. I came up positive for PCI 24 uranium and plutonium exposure. I have elevated levels of manganese, rubidium, and strontium, which has been said that there's no strontium-90 there, but if it's coming up positive from my test, which I've taken 5 of them from 5 different labs, we have to really take a real look at how we provide care for that vulnerable population. And it's one of the reasons we have the highest level of respiratory lung disease, asthma amongst youth and adults, as well as cancer in the community, especially with generational residents. I'm also the arbiter of AB 617, working on the air admissions plan for District 10 to try to bring down some of the numbers of some of the health outcomes in the community. But we need your help. And, you know, it's going to call for you to step up beyond the confines of the structures that you're within, that have the restraints to really create something outside of that bubble to address the people that has been desperately calling for you guys' help forever. Thank you.
Thank you. Would anyone else like to make a comment? You're welcome to come up to the podium. And again, 3 minutes. When the buzzer goes off, please know your time is up.
I won't need that much. Thank you. My name's Donna Canale. I'm a retired nurse. I used to work over at Tombadale Clinic. This is just a general comment because I've been attending some meetings with Bayview Hunters Point folks, and I'm taking some tours there, and just very concerned with the speed of how the Superfund is being cleaned up there, and how it's affecting people in the area. And I've been very impressed with I've been seeing the local people there working really hard to improve the conditions for the whole neighborhood, both in terms of getting those nasty chemicals out and to bringing health care to the area. And I just want to encourage this commission in whatever capacity you have to forward that and encourage that corrections. Thank you.
Thank you. All right, anyone else? Okay, that ends public comment. We can move on to item 3, San Francisco City Clinic update. And give me a second to pull it up. Okay.
All right. Can you hear me?
Yes.
Okay.
And remember, just remember the papers and the microphone. Yes.
So up here is okay, down here is not okay.
That's great.
Okay, great. All right. Good afternoon, and thank you for this opportunity to talk to you about San Francisco City Clinic. My name is Oliver Bacon. I'm the medical director for City Clinic, and I'm here with my colleagues, Dr. Franco Chevalier, the deputy medical director, and Christopher Ruiz, the coordinator for our biomedical prevention team. So we're going to talk about what City Clinic does and how its programs and workforce have grown to meet the sexual health needs of San Francisco. This includes the many sexual health services we provide under one roof, our compassionate, destigmatizing, low-barrier access to these services, how we innovate to meet sexual health challenges affecting San Francisco and beyond, including our role in the HIV ecosystem in San Francisco, and how we're evolving to ensure that we offer care in a way that meets the needs of the communities we serve. So let's get started. Next slide, please. And next slide, please. Great. So this is a Department of Public Health org chart. City Clinic sits in the Population Health Division of the Health Department, or PhD. Like our fellow PhD clinics, the Tuberculosis Clinic and the Adult Immunization and Travel Clinic, we are distinct from, but collaborate with, the clinics and San Francisco General Hospital that make up the San Francisco Health Network on the other side of DPH. Next slide, please. Within population health, we are in the disease prevention and control branch, and within DPC, City Clinic is part of the HIV STI program. We work closely with a number of other teams, including LINKS team. LINKS stands for Linkage, Integration, Navigation, and Comprehensive Services, which does partner services interviews for persons with HIV, syphilis, and Mpox. And many of the LINKS supervisors and disease investigators are co-located at City Clinic. We're also highly aligned with the San Francisco Public Health Laboratory, which develops and adapts existing diagnostic tests for us and the city to help respond to emerging STIs, such as Mycoplasma genitalium, or MGen, Mpox, or the possibility of antibiotic-resistant gonorrhea in the future. We also work closely with Arches Epi, adding our clinic data to their citywide surveillance, and for analysis of our clinic data to use in our internal quality assurance and quality improvement work. And we also work with CHEP, or the Community Health Equity and Promotion Branch, particularly in our relationships with community-based organizations. Next slide, please. Okay, so we saw 6,060 patients, over 11,856 visits in 2023. So what does City Clinic offer that would lead someone to come here for their sexual health? First and foremost, we are a center of excellence for sexual health, but what does that mean? Clinicians, nurses, counselors, health workers, behavioral health specialists are all focused on our mission, which is to provide state-of-the-art sexual health services to our patients in a friendly, professional, and non-judgmental way, and help protect the public health. We can offer same-day, low-barrier treatment for all STIs, for HIV prevention and treatment, and cervical cancer screening, and some forms of contraception. We have walk-in and scheduled appointments to fit people's lives. We have an on-site clinical lab that allows same-day diagnosis in many cases, and almost all of our treatment medications are dispensed on-site without the need for a prescription or a trip to the pharmacy. In addition, we are a training hub for healthcare providers. We have a robust training program in STIs and HIV treatment and prevention for medical students, nurse practitioner students, residents, infectious disease fellows, and phlebotomists. Providers from all over the country adapt our treatment protocols and patient-facing materials for their use, and I invite you to visit our website, sfcityclinic.org, to see the range of services and resources we offer for patients and providers. But don't, next slide, please. But don't take my words for it. These are some quotes from Yelp reviews of visits to City Clinic. I'm going to read the first and the third one. The facility and staffing is comparable or better than any private medical clinic. If you have STI symptoms and are needing care and attention immediately, go to City Clinic. They will do you right. And then the third one. The kindest, gentlest, most well-informed clinic I've ever seen. They're fast, efficient, and non-judgmental. They really listen to your concerns and answer your questions. If you're having sex, you owe it to your partners and to yourself to know your status. Next slide, please. Okay, so we're going to turn to the national perspective now. So for over a decade, rates of the big three STIs, chlamydia, gonorrhea, and syphilis, have been unacceptably high in the United States. These, along with HIV, are reportable to city, state, and federal health authorities, and they cause the most morbidity. For example, chlamydia and gonorrhea can cause pelvic abscesses and permanent scarring of the uterus and fallopian tubes, leading to infertility and increased risk of potentially fatal ectopic pregnancies. Syphilis can disseminate to the central nervous system, causing vision and hearing loss. Congenital syphilis, that is, syphilis acquired during pregnancy, can lead to stillbirths and developmental complications in the newborn. And finally, there's a 3 to 5-fold increase in the risk of acquiring HIV in persons with active chlamydia, gonorrhea, or syphilis who are not taking HIV pre-exposure prophylaxis, or PrEP, and we know that PrEP is reaching only a fraction of people who would benefit from it. In addition to the big three, we also diagnose and treat a host of other sexually transmitted infections, including herpes, trichomonas, and Mpox. We have treated the most Mpox of any healthcare site in San Francisco. Having a clinic dedicated to STI diagnoses and treatment, and one that serves as a resource for other healthcare providers in San Francisco, can help address this epidemic. Next slide, please. High rates of STIs are also a local San Francisco phenomenon. This figure compares rates of chlamydia, gonorrhea, and early syphilis, which is the most sexually transmissible form of syphilis, per 100,000 persons in San Francisco in dark blue, Los Angeles in orange, and New York City in green. As you can see, San Francisco's rate of chlamydia almost matches that of New York, and our rates of gonorrhea and early syphilis exceed rates of those infections in Los Angeles and New York, both of which have many times the population of San Francisco. Next slide, please. Unfortunately, there are racial and ethnic disparities in STI rates in San Francisco, and all epidemics are local and don't affect all populations equally. This figure shows rates of chlamydia, gonorrhea, and early syphilis per 100,000 San Franciscans by race ethnicity, compared with the overall rate shown in the dark blue bars. For all three STIs, Black African Americans in green have the highest rates, followed by Hispanic Latino in light blue, and both exceed the overall rate in the city. In 2023, next slide, please. In 2023, City Clinic diagnosed as a single clinic 7% of chlamydia, 12% of gonorrhea, and 14% of early syphilis cases in San Francisco. Other high diagnosing sites include the hospitals in aggregate and our partners at the San Francisco AIDS Foundation's Magnet site in the Castro. This figure shows that City Clinic sees a proportionately high number of Black and African American and Hispanic and Latino persons compared to their proportion of the city population. And we know from the previous slide that these two groups are disproportionately affected by STIs. To serve our next slide, please. To serve our public health mission, we have to be open to everyone. And despite disparities, STIs affect all groups. They are, in some sense, a great equalizer. We are fortunate to be not restricted by insurance in whom we can see, which distinguishes us from most other healthcare organizations, including the Health Network and other health systems in the city. 40% of our patients are uninsured. Those who do have insurance, whether it's Medi-Cal or commercial insurance, choose to come to City Clinic for their sexual health. In addition to all the reasons, expedited diagnosis and treatment and expanded access that I already mentioned, there is this: people feel safe talking about sex at City Clinic. Next slide, please. Okay, so what happens when you walk through our doors? Aside from our HIV clinic, City Clinic operates like an urgent care specializing in sexual health. People often come to us with multiple needs, and we combine our services to meet their needs in one visit. This is what many people want from healthcare, and it's what we know reduces loss to follow-up and supports treatment success. So, in one visit, a person might be screened for STIs and HIV, next. Get treated for an STI, next. And be referred to the biomedical prevention team for doxycycline to prevent STIs, or PrEP to prevent HIV next. Or they might test positive for HIV and undergo a rapid start next. Or they might get cervical cancer screening that they're due for next, and can get Narcan, fentanyl test strips, and referrals to substance use treatment next. And people often get any combination of these services. Let's shift now to talk about some of the innovations we've incorporated into our care. We've been a national leader in biomedical prevention for HIV and STIs. We collaborate with sexual health clinics around the United States on NIH and CDC-funded implementation science research. That is, research that's focused on turning interventions and discoveries made in clinical trials to actionable prevention and treatment for patients in clinic. We were one of 3 sites in the PrEP demonstration project, or PrEP demo, which showed that the use of antiretroviral medications to prevent HIV could be successfully implemented at scale in a busy urban STI clinic. What we learned from that participation led us to create our own high-volume PrEP program, contributing to the dramatic declines in new HIV cases in the city over the last decade. Christopher Ruiz, the biomedical prevention coordinator, is now going to tell you about our PrEP and DoxyPEP programs.
Good afternoon. An integral part of our work at City Clinic has been in STI and HIV prevention, since our early days as part of the PrEP demonstration study to today, a fully incorporated practice/standard of care. We've helped close to 5,000 people start on PrEP, particularly amongst individuals at increased risk for HIV. Of the 4,970 PrEP starts, 60% have been African American, Latina, Asian Pacific Islander, or Native American. 57% are individuals that are on Medi-Cal or uninsured. Our navigators work hard to help people access medications at little to no out-of-pocket cost. Providers and navigators help patients decide on what the best PrEP option for them might be. We offer oral PrEP taken daily or as needed, and the newer injectable option as well. Giving patients choice and supporting them with our knowledge and experience of prescribing PrEP for over a decade. Next slide. Another prevention innovation at City Clinic is DoxyPEP, which is the use of the antibiotic doxycycline to prevent chlamydia, gonorrhea, and syphilis. From 2020 to 2022, City Clinic was one of 4 STI HIV clinics to enroll MSM and trans women in the DoxyPEP trial. The trial was so successful in showing that taking doxycycline after condomless sex reduced the risk of acquiring common bacterial STIs that the study was stopped early. Findings were presented at both domestic and international conferences. In October of 2022, the SFDPH released the first ever DoxyPEP clinical guidance from a public agency in the US. That same month, City Clinic got to work creating and implementing protocols to provide this new development to patients. Shortly after, DoxyPEP became a routine part of care and prevention at City Clinic. City Clinic continues to expand DoxyPEP access, recommending it for patients who met the original study criteria, offering it to MSM and trans people who have risk. And while efficacy in persons assigned female sex at birth has not been demonstrated, discussing on a case-by-case basis with cisgender women. Next slide. City Clinic has started over 1,700 people on DoxyPEP. The outcomes are very apparent, with sharp declines in chlamydia at 90% and early syphilis at 56%. The feedback has been overwhelmingly enthusiastic from our patients. They have noted the positive impact of fewer STIs on their partners, relationships, and the community, as well as the feeling of greater control of their own sexual health and well-being. Next slide.
Thank you, Christopher. City Clinic plays an essential role in the HIV prevention and care landscape in San Francisco. We are a high-volume HIV testing site, diagnosing over 10% of all new cases in San Francisco annually. In 2023, we screened over 3,800 people for HIV with 18 positives, some of which were actually from other counties too. We are also an open door for people living with HIV who are seeking to re-engage in care. Everyone newly diagnosed or returning to care is offered a rapid start, meaning starting treatment with antiretroviral medications on the day of their visit or within 5 working days. Rapid starts have been shown to help patients achieve an undetectable viral load faster than standard of care, and this benefits their health as well as the public health, since people who have an undetectable viral load cannot transmit HIV to their sexual partners. It also empowers newly diagnosed persons to take control of their health. City Clinic staff helped create the RAPID program in San Francisco, and we were an early adopter and part of the Getting to Zero consortium seeking to end the HIV epidemic in San Francisco. Next slide, please. So rapid starts and restarts are usually unscheduled and require a lot of work, and they require many teams to collaborate in a short amount of time. This has required us to innovate in the following ways. We have virtual huddles of rapid teams, of the rapid team to quickly coordinate care. We are training all clinicians on rapid starts and restarts to maximize the efficiency of our patient flow. The HIV social worker and the HIV dedicated links navigator have been trained to do same-day enrollment and 30-day ADAP so that patients can get their medications the same day they're seen. And the links team provides short-term support to persons newly diagnosed to help retain them in care at City Clinic or to link to an HIV medical home that suits their needs. Next slide, please. So in 2020, we were one of 19 sites nationwide to receive a competitive supplement to our core CDC HIV Ending the Epidemic grant. This was a 4-year, $2.8 million grant intended to optimize HIV prevention in sexual health clinics and to develop best practices for nationwide dissemination. It has supported multiple innovations, including building a PrEP registry in EPIC, scaling up PrEP Express visits, implementing long-acting injectable PrEP that Christopher talked about, initiating Medi-Cal billing, and working with the community and an SF-based artist group, Persida Eyes, to beautify the facade of our 100-year-old firehouse. In 2024, we used this funding to conduct a clinic assessment focused on patient satisfaction, clinic efficiency, and quality of care, and to help develop priorities and strategies for the next 5 years. This included in-depth interviews with staff, observations of clinic flow, and focus groups with community members. In August of this year, we were one of 15 recipients nationwide to receive a new cycle of competitive funding to continue this work and move forward our strategic plan. Dr. Franco Chevalier, the Deputy Medical Director, is now going to talk to you about our community outreach work.
Good afternoon. So City Clinic embarked on a clinic assessment that evaluated our current HIV and STI prevention services. Our goal was to identify ways of maximizing our capacity while providing high-quality care to those impacted by STIs and HIV. With the help of a consulting group and in partnership with CHEP, we identified 3 community-based organizations who we engaged in community conversations in order to gain understanding on current sexual health knowledge and priorities, as well as the awareness of services available in their community. The CBOs were Wise Health, Urban Ed Academy, and Third Street Youth Center and Clinic. They work closely with the Bayview community in San Francisco, which is largely Black African American and disproportionately impacted by STIs. This work allowed us to identify both short and long-term opportunities to strengthen partnerships and increase trust and engagement with this community. Next slide. The conversations with these community members revealed several important things. Number one, there was a lack of awareness of City Clinic and the number of services that we provide as an entity. Number two, our services and messaging need to be culturally relevant, with a focus on increasing sexual health knowledge using non-stigmatizing, all-inclusive language. Number three, the community enjoys face-to-face interaction to learn about services and ultimately build trust. They also want to see themselves reflected in those whom they seek care from, especially in terms of race and ethnicity. Lastly, we have a unique opportunity to open our space for tours so that these CBOs can meet the staff and become familiar with their services and space. The goal is to continue to expand on this work and evolve these relationships while developing new ones in the future. Next slide. We've also begun our work in creating our own patient-facing materials to promote our services at community health events. As seen on your left, this flyer was a City Clinic-led project created by internal staff who designed, reviewed, and translated it to English, Spanish, and Chinese. Finally, on your right, you'll notice a screenshot of our Welcome to City Clinic infomercial video. This is a virtual tour of the clinic that currently lives on our website as well as YouTube, and it was filmed both in English and Spanish, and is also available in Russian, Chinese, and other languages for people to get to know us a little bit better. Next slide.
Thank you, Franco. So to conclude, City Clinic aims to provide low-barrier access to traditional and innovative sexual health services to all San Franciscans. We offer state-of-the-art STI and HIV testing, prevention, and treatment in a judgment-free and welcoming setting. Clinical and implementation science and a focus on quality improvement support these goals. And finally, as much as we love it, our 100-year-old firehouse has problems. It's not ADA compliant or up to current code. The rooms are too small and inflexible, and this impacts patient flow and efficiency. Our heating and plumbing systems are not reliable. We're very excited that Prop B passed, and we are embarking on looking for a new clinic. Next slide, please. There's a lot of people to acknowledge for their work at City Clinic. City and City Clinic leadership, Stephanie Cohen, Judith Sansone, who spearheaded the mural project, and many, many, many of the clinic efficiency improvements. Trang Wen and Bob Cohn in Arches Epi, Julia Jansen in Lynx and Radar, Susan Phillip, Frank Strona, who has been the master of our website for years, Mantika Levy, who was previously the biomedical prevention coordinator, and all of the staff at City Clinic, registration workers, clinicians, nursing, biomedical prevention, links, IT, social work and mental health, and research. Next slide, please. Thank you very much.
All right. Would you like to, let's see if there's any public comment in the room on this item? Anyone? All right, commissioners, if you have questions or comments.
I want to thank you for your presentation. I believe the services that you're providing for the city.
Oh, excuse me? Oh, sorry, Commissioner. I
okay.
apologize for
No worries.
that. All right, so I have a timer. When the timer goes off, Hi, excuse me. Hi. So you've got 3 minutes, and when the timer goes off.
Won't take 3 minutes.
Okay,
but-
there we go.
So my question is this, and so in Bayview Hunters Point, we have undergone, most of us knowing that somebody has asthma, cancer, brain cancer, and tumors. So my question is, for DPH, like, what is the plan? Like, I just read the San Francisco City Clinic plan. I hope I'm saying it right, sorry. But my question is, how are we, like, activating the youth so that they know what's going on, one. Two, like, what are we doing to, like, put precautions on, you know, our high diesels that are coming through the crowd that are like, high industrial warehouses, and I'm gonna talk to everybody when I turn around, so, yeah, that's my question. So, like, what is the plan that DPH, like, what role does DPH have in, like, participating in making sure that we have precautions for that?
All right, thank you. Just
my
know
question was
that
clear.
when people ask questions, it's not a back and forth. We noted your question. Thank
okay.
you very much.
Okay.
And have a seat. And
Thank you.
And we'll move on. Thank you.
Thank you, thank you.
Wait a minute, before you leave, go tell them what your name is.
Well, you know, okay.
My name is Samir, hold up, let
Okay.
me get to the mic. My name is Samira Niru. I go by Sammy. I've worked for PUC for 8 years, and now I work for the Marie Harrison Community Foundation. So I know plenty enough about what's going on with the water. So, and now I know what's going on with the environment. That's why I came up to the podium.
Okay, thank you.
Thank you.
All right, Commissioner Salgado.
Okay. I just wanted to thank you for the presentation, and the work that you're doing here in the city is awesome and amazing, because I know growing up in the city, a lot of these clinics were used by my friends and myself. So we do thank you. And keep up the good work.
Thank you for the presentation, and I also appreciate answering my questions, which were multiple, and I appreciate it. I was most interested, and I appreciated the age information too, since I've sent many teens to the city clinic, since they do not want to go to their pediatricians to discuss this. So also based on that stream of thought, I am assuming that you are reaching out to, let's say, the Balboa Teen Clinic and any of the other teen clinics so that there is a flyer or some information about City Clinic. It's not something that a lot of teens necessarily know about. And so I'm hoping that just your outreach is really out there in this group of under 20s because it is there's a significant increase, as you noted, but also noted in the adolescents that I see and send them to you when there is any question. And unfortunately, it does come back positive. I mean, not of the clinic, but of their testing, et cetera. So I really encourage you to do even more outreach within, the Balboa Teen Clinic or any of the other DPH youth-focused clinics. I think it would be really important. And I had one more question, and in the presentation under community engagement and outreach, I was, most interested in the feedback that you were able to give. With the 3 clinics, what specific of your goals? I understood about identifying opportunities to enhance services to, et cetera. One of the things I know that you specifically mentioned was the outreach, was the language, which I think is essential. But I'm also wondering, and maybe I don't know, I didn't catch it. I'm interested in what other ideas or opportunities did the clinic specifically make for you in
No, thank you. That's a very good question. So I think as part of the City Clinic tours that we mentioned, we've been able to successfully actually host 2 of those organizations already on site.
Okay.
And what that led to was not only for them to get to know our space, get to know the staff members and exchange sort of contacts and information about their resources and and the capacity that they have in order to sort of sustain an STI program and HIV program, but also for them to learn from us and also refer back and forth should they have any limitations in terms of doing things for their patients. And so one of the big topics that came up, for instance, I believe it was actually specifically with Urban Wise Health specifically, was in the context of accessibility. So for instance, they work more of a consulting group where they may have patients from various clients and patients in community health events that may live all throughout the city. And so for them, having City Clinic as sort of a member of their referral sites, it's just another opportunity to increase access for individuals that may be either closer or just from the sense of a level of comfort to talk about specific topics. And so while we understand that obviously we're not all encompassing and we're not treating everybody, it's nice to know that now they have access to another yet clinic where they can access those resources. The other big thing that has come out of these conversations that amongst leadership we've been talking about is potentially developing a patient advisory council, which is going to, in what we foresee at least, is to be made up of the patients that we currently serve and the communities that we currently serve so that they can continue to further advise us and sort of provide more feedback, live feedback both from the services that they're receiving and the lack thereof, and also the gaps so that we can potentially bridge those gaps. So there's a lot of things in the works and things that are continuing to evolve, but those are the main things that have come out so far.
That's great. It's most interesting to have their feedback as well, since they are, the recipients of your services. Like I said, I've referred for years, but there's such an increase in those that really are uneducated, kids or adolescents, young adults, about STIs. And so I think that outreach, I think, would be super helpful, as well as you, when you are so-called marketing or advertising what you do, so it can actually be catchy, or in any kind of flyer that you have, that the artwork for would be something that would catch their eye, so to speak, so that they understand your services. So in a future presentation, I'd love to even hear, more feedback of the great work that you're doing. But it's well needed, and I hope you do find a new building. But please don't make it too clinical and modern. Just make sure it's very, very welcoming to people, because when they walk through your doors, their anxiety is very high. So, but great work, and I really appreciate the presentation. And again, your quick response to my questions. So.
Commissioner Dorado, if I may, is there any response that y'all have to her suggestion or question around connecting with DPH youth programs or youth centers? I'm not sure if the previous discussion that you just had kind of conveyed all of that. I'm not sure if there's anything else to add. Yeah. Could you go to the podium just so we can hear you?
Yeah, no, I very much appreciate that perspective and that advice. We have in the past worked with the Chippy clinics. I would love to hear from you specifically where you think it would be most high value for us to go. And also, I appreciated your thoughts about making the outreach materials friendly to that age group.
It's great. Well, I would love for you to start in the SFUSD high schools, for starters, in their wellness clinics. So almost every high school has a wellness clinic, not to the extent like Balboa has a DPH teen clinic, but Galileo, Lowell, all of them have a wellness clinic where can get referrals and also short-term counseling or whatever else. But to have the information to those wellness clinics in all SFUSD high schools would be a great start.
Okay.
The other DPH clinics that serve, the transitional youth and whatever should have your information, and if not, should at least have this wonderful flyer that you're going to be so creative in putting together. But I just think, it would be really helpful in the wellness centers, because kids are going to be afraid to ask. But if you have just some very basic information, free, confidential, and, sexual issues, questions, I think you'd be doing a great service. So.
I appreciate your advice. Yeah, thank you.
All right, thank you, everyone.
Thank you.
We can move on to item 4, the San Francisco Behavioral Health Services Act update. And give me a moment to pull it up. And just let me know when to go to the next slide, please.
Okay. Can you all hear me okay? Yes. Hello, my name is Danielle, Danielle Marshall, Deputy Director for Justice, Equity, Diversity, and Inclusion, and I serve at the pleasure of Jessica Brown, who's the Director of the JEDI and Behavioral Services Act. Next slide, please. So just to give you a little overview, Behavioral Health Services offers a full range of especially behavioral mental health provided by a culturally diverse network of community behavioral health programs that include private psychiatrists, psychologists, and therapists. And we also offer mental health and substance use services that include outpatient treatment, inpatient treatment, medication management, linkage services, and a large array of more specialized treatment services. These services are available for San Francisco residents who receive Medi-Cal benefits, as well as the San Francisco Health Plan benefits. Next slide, please. I want to give you an overview of the Behavioral Health Services Act. So some of you may know that it was the Mental Health Services Act that was enacted in 2005, and that the money is gained by 1% tax on persons whose income is over $1 million. March of this year, the Behavioral Health Services Act was passed under Prop 1, and the new law includes a $6.4 billion behavioral health bond for community infrastructure and housing services for people. Next slide, please. Sorry. So each year, BHS, Behavioral Services Act, is required to collect community and stakeholder input and integrate this feedback into all areas of BHS programming. A 3-year integrated plan or annual update is required as well. So for 24-25, the mental health annual update is a report that provides, we provided to the Board of Supervisors that was approved for 23 to 26 Behavioral Health Services 3-year integrated plan. The annual plan includes community programming input, programming outcome highlights from 22-23, and plans for 24-25. Okay. Per the new Behavioral Service Act regulations that was passed as a result of Prop 1 in March, that's supposed to be 2024. Counties are required to finish our 24-25 and 25-26 MHSA annual updates before starting the new 26 to 29 3-year integrated plan. Therefore, on all these documents, you're going to see MHSA as opposed to BHSA. We want people to start getting used to saying BHSA. Next slide, please. Okay, so Mental Health Services Act funding components, there were 5 categories. It was community services and support, which was CSS, innovations, prevention and early interventions, workforce education and training, capital facilities and technological needs, and San Francisco put that under 7 services that funds about 85 programs within San Francisco. The programs include recovery-oriented treatment, mental health promotion, peer-to-peer support services, vocational services, housing and housing for FSP clients, which is full-service partnership clients, workforce development, capital facilities, and information technology. Next slide, please. Community programming. In 2023, our county staffed hosted 5 community engagement meetings across the city. Over 105 individuals participated in these engagements and planning meetings. The community member feedback helped shape existing and future programming and the 24-25 update. So we increased our outreach to include more involvement with certain stakeholder groups, which were local veterans, transitional age youth, vocational program participants, older adults community, the LGBTQ community, primary care and medical staff, employees of municipal agencies, law enforcement, maternal health providers, SFDPH Department of Equity, and Black, African American, and Latinx communities. Next slide, please. Some of our highlights are, these are outcomes, or small sample of the outcomes we achieved. If you want to have a fuller picture, the annual update is where you will find some of this. We sustained funding for the current programs and services with demonstrated impact. We provide additional funding to strengthen population-focused mental health promotion and early intervention programs. We expanded the San Francisco Dream Keepers initiative. which provides comprehensive support for 300 Black and African American families struggling to meet basic needs due to systematic failure in educational activities for 500 African American youth. We're piloting a project to bring culturally affirming patient navigation support to the city's Chinatown North Beach Clinic. We provided talk therapy to Black African American clients throughout San Francisco and provided support to various clients within our population-focused programming. Next slide, please. Some of our program outcomes reported the following. Our full-service partnerships reported 79% decrease in arrests for adults, 88% decrease in mental health and substance use disorders emergencies for adults, and 96% decrease in arrests for youth. Under the mental health and early interventions, 53% of our clients within a school-based program reported improvements in their relationships with their families and with their friends, and 85% support and wellness clients reported feeling less isolated. Our vocational services, 100% of our graduates from the janitorial services vocational program reported improved coping abilities and increased readiness for employment or additional activities related to vocational services. And for our peer-to-peer supports, 95% of peer-to-peer, family-to-family clients reported an increased understanding of their mental health needs and were better able to understand behavioral health signs. Next slide, please. Let's see. So we'll go to that. Okay. The 24-25 annual update includes the following. Sustaining funding for the current 85 programs and services that have demonstrated to have a significant positive impact of San Francisco communities. We'll continue to implement, support, and evaluate the new funded programs by improving maternal mental health for Black African American birthing people, Homeless Children's Network's MIAD program, the Kumba Peer Fellowship Program, the Free Minds Initiative, Fuerte, Wellness in the Streets, and culturally sponsored practices for the Black African American communities. Continuing to grow full-service partnerships by expanding treatment slots and continuing to work with the state to implement new BHSA regulations per the passing of Prop 1. Next slide, please. Spotlights on San Francisco's changing needs. You all are aware San Francisco faces severe crisis of mental illness, overdose, homelessness, and housing insecurity, each factor exacerbated by the high cost of living and the compounded effects of trauma and systematic racism. We're committed to being a part of San Francisco's mental health system transformation that provides mental health care to all San Franciscans who lack insurance or who are experiencing homelessness. At least 51% of funding addresses serious mental health and co-occurring substances use challenges throughout our full-service partnership programs. Comprehensive housing programs work to better meet the needs of unhoused individuals. Population-focused programs address racism and equity issues, and Wellness in the Streets program primarily work with individuals directly on the street and provide peer services, support, and interventions to the community. Next page. So we do have an emphasis on evaluations, and we place a strong emphasis on program evaluations. Over the past years, we worked hard to enhance our monitoring and evaluation activities to effectively meet the objectives of our program. So we have improved tracking efforts of our intensive case management to outpatient referrals and outcomes. We've increased evaluation efforts of innovation projects, improved SMART objectives for contracts, improved evaluation frameworks for new requests for qualifications or RFQs. We've increased evaluation efforts with Ginger Health San Francisco and improved the monitoring of our PEI evaluation activities. Next slide, please. Prop 1, so for the next 3-year plan, for 26, 27, 28, 29 will reflect adjusted programming in alignment with the redesigned program categories under Prop 1 and will appear under the new program name, the Behavioral Health Services Act. According to state guidelines, the implementation timeline is until July 1st, 2026 to meet Prop 1 requirements, and current MHSA spending is not fully in alignment with the BHSA. DPH will be planning to bring our programming into alignment as the state releases additional guidance, and state guidance on the next 3-year plan will be released throughout 2025. Next slide. Okay, as you can see, the transformation milestones, we started in spring of 2024. Some of the bonding and implementation came in summer of 2024. We will begin implementing Prop 1 in early 25 with the integrated plan, guidance, and policy. We're still waiting for the state to finalize some of their expectations, and then by summer 2026, we will be implementing the new integrated plans, fiscal transparency, and data reporting requirements. All goes live of summer of 2026. Next slide. Thank you. Again, my name is Dr. Danielle Marshall. I'm the Deputy Director. I can try to answer any questions you may have, but if I don't know the answer, we'll give it to you in writing. So are there any questions?
Well, first we check with public comment.
Okay.
So, if there, excuse me, is there any public comment in the room on this item? All right. Commissioners.
Yeah, thank you so much for answering a number of my questions ahead of time. And I have just a couple more, especially on the FSP programs, since you delineated exactly the programs that were part of FSP, which were great. How many people have been in the program over the last year with a combo of the number of agencies that you listed?
Are you speaking of a specific or all of the FSPs altogether?
The FSPs that you listed to me?
Yeah. Unfortunately, I did not bring that printout, so can we get back to you on that question?
Yeah, I'd appreciate it because that information I feel would be really helpful, since one of the goals was also to increase treatment slots for FSP.
Yes.
It's like, how many are there? You know?
Yeah, well, the other side of it is too with the full service partnerships.
Right.
Because of the, how Prop 1 is being funneled down through the state to San Francisco, people are finding it increasingly difficult to meet all the parameters of the full service partnerships. And so there's a lot of negotiation that's going on at the state level, and they're looking at a tier system, so a level 1, level 2, level 3 of treatment. And we're waiting on word, meaning all of California is waiting on word to see if that's going to be implemented. And then that's when we suspect our full service partnerships would be able to continue the great work that they're doing. But everybody is like a little weary on what does this actually mean.
No, and I understand that, but I'm just wondering,
Yeah, how many?
as is now,
Yeah,
how many are in it?
I will have to get back.
Thank
to
you.
on that.
My other question that you answered too was about the mental health promotion. And I was really, very thrilled with the number of schools that
Yes.
participated. It was, mainly elementary schools for the early intervention. But in the mental health promotion, what was the vehicle that was used in all of those elementary schools? I mean, how was it relayed? Is there a specific social emotional curriculum, or how did it get across to the?
My understanding is that some of our PEI programs are our early intervention programs, prevention and early intervention programs are embedded in some of the schools and are doing that work on our behalf. But I'm sure that, and clinical settings as well. But I can say that, I know that, but if there's other vehicles that are used, I have not heard of outside of using our preventive and intervention programs outside of any other media that's being used than that. I know that they're embedded in the schools as well.
Okay, but so, I mean, just because I'd been in the school, I mean, I used to teach.
Yeah.
But in the schools, especially in the elementary schools, or in the middle schools, how do they reach the kids versus like a separate office, or is it in homeroom time, or, how do the kids know what you're trying to?
Some of these programs are after-school programs embedded in some of the after-school programs.
The after-school,
I do
okay.
not know if they do pull-out, push-in services in the classrooms, or if they're working with the school counselors as well. I know some of them are working with the school counselors. I'm not sure of all of them. So for a more concrete answer, may I also give you that in writing as well?
Yes,
Okay.
I'd appreciate it.
Yes.
And I'd also be interested too, when you're looking into it within the early intervention, has there been a social emotional curriculum, since many of the schools are integrating that into, homeroom meetings once a week or whatever, that there is a social emotional curriculum, since that's kind of a hallmark of early intervention too in some of the schools. I'd be most interested if in fact there is one.
For what I know that they're doing culturally congruent work in our PEI programs, but I do not know if they're using the social emotional curriculum that a lot of schools use. I think that what they're using is in addition to what is being taught in the classrooms as well.
Okay. Well, I would be interested, since
Yeah, to know.
social emotional curriculums need to be in many of the schools going forward. There was one other question I had about the milestones on the bond funding and availability, and what has been the application response to
Yes.
the funding availability.
So Kelly Kirkpatrick, that works with Hillary, is the one that is dealing with the bond funding issue. And so that's the person that is going to have to respond to your question regarding that. We're not dealing with the bond monies right now. We're dealing with the other side, the SB 326 Prop 1 side. So I will send an email and let Kelly know to.
That, I would appreciate it. I just am wondering how many are stepping forward
Correct.
to really want to go forward with this work, that are legitimate, so to speak, and have, contracts with the city already so they can implement their work.
Expand, yeah.
So
Thank you.
I'd appreciate it, the information to go to Mark, and then, to the rest of us would be.
Okay,
And I'll ping you, I'll do a list of, and I'll CC Jessica too.
thank you.
Sure.
Thank you.
Thank you.
Thank you so much.
Do you have any questions? Okay.
All right, thank you very much.
Thank you.
And gentlemen, please feel free to go back to your busy work lives. Commissioner, since I think we have more people here to do general public comment, can we go back to general public comment?
Absolutely, we can go back.
Yeah. Let's first do emerging issues real quickly.
Okay.
Anything?
I don't have any other emerging
Okay.
issue.
So we can move to general public comment. And
Sure.
Dr. Somchai, we've got 3 minutes on the clock for you.
Sure. Dr. Ahimsa Porter Somchai, thank you for the opportunity to speak with you. I wanted to talk to you about a very important emerging issue that has direct impact on the San Francisco Department of Public Health, and specifically community public health for a couple of reasons. The issue is centered around the Navy's recent release of the Parcel F record of decision on September 26. And this is a document that at minimum is incomplete and at maximum constitutes a fraudulent document. It omits virtually all of the radiological mapping and raw data that was included in prior evaluations of the sediment area around the perimeter of the base. Most of the radiological data is included in a document published in 2017 called the Parcel F Addendum to the feasibility study. And it is of significance to you because, one, the Southeast Health Center is less than a quarter of a mile from regions that are very dangerously exposed to radioactive emissions. And secondly, because the city and county of San Francisco contracts with the Navy to site large populations on the base in areas that are historically documented to be radiation contaminated. One of the largest populations are the Artists, about 400 of which are in the India Basin region. So I just want to leave with you a couple of documents. One of the most egregious deletions were the cumulative risk and hazards estimated for child exposures. And in the India Basin area, where they just opened up a beautiful park, there are direct contact exposures for children as high as 9.8. As you know, a hazard index has to be less than 1. And this pattern repeats itself throughout the region of Parcel F. I will leave these with you. Most significantly, independently, in 2012, the Department of Homeland Security conducted an area radiological survey of the California Bay Area, and they detected astronomical counts per second in the South Basin area, again within a quarter of a mile of the Southeast Health Center. They detected counts per second as high as 7,700 counts per second. What this data proves is that the radiological waste at the shipyard is high level.
Your time is up.
It's not low level. Okay, let me just leave these documents with you.
Thank you. You can consider, please consider a motion for adjournment.
I so move to adjourn
I
the
second.
committee meeting.
I second.
Okay, all those in favor?
Aye.
Thank you so much. Give me 10 seconds to shut down the meeting, and thank you all who were watching and participated.